Hi, I'm Alex Mitchell, and I'm a communications manager with Lighthouse Lab Services. And I'm here today with Mick Raich. He's the president of RCM Consulting for Lighthouse and also the founder of Vachette Pathology, Lighthouse's RCM division. So, Mick, thank you for taking the time to be here with me today.
Thank you very much. I also should note that I'm Alex's third grade baseball coach. So we go way back.
We definitely do, and I'd be very kind of you if you held the embarrassing stories for another subsequent video.
You have a couple on me too, so it's a fair, it's a fair shake.
Sounds good now that we've agreed to the ground rules here. Well, at the end of the month here, we're gearing up for Medical Laboratory Professionals Week that runs April 24th through 30th, and it's a big celebration for the Lighthouse team. Another milestone that we just celebrated was Bichette celebrated its 20th anniversary just this past Friday. I know you got started on April Fools. That's always one that's reminded for me is a fun date. But now that you've had 20 years in business, Mick, I'm kind of curious. You've been working on revenue cycle challenges for your clients for a long stretch of time. You've seen the industry evolve quite a bit. So what are some of the most significant RCM challenges you've seen develop during your time in business, and how has Vachette had to adapt to meet your clients' needs over those last 20 years?
A lot has changed in 20 years. It's become much more complex. Um, the whole billing concept has become more complex, and that's something we've had to do. We've had to refine our audit process. At the beginning, it was just pathology. Now it's laboratory, and we've had to continue to refine our audit process as the payers have changed their denial logic, and it's become harder and harder to find what they're doing. And so we've had to become more and more detailed in what we do and more automated in what we do. We have some great things in the future. We're looking forward to help automate our audit process, but that's something we're always going to have to do is refine that as we go forward. The other thing I've noticed is there's been a lot of M&A activity in the billing world. Okay, so we went from 5,600 billers at the International Billing Association, the IBA, to the Healthcare Billing Management Association now, and there's only like 2,300 left. So we've seen a lot of this consolidation, and this has forced a lot of layers of management we've had to deal with in the billing world, and it's made it harder for us to get information, harder for them to hear and allow us to make changes as we need to go forward. So it's really interesting to see all the offshoring going on in billing and how that's affected the RCM side. The whole whiplash effect of COVID and what that's done to AR and the RCM industry. So we're not done. I mean, the sky will fall again next year, and we'll have to move our feet to figure out what we have to do to make sure we're doing the right thing for our clients.
That's interesting that you bring up COVID and the pandemic as we talk about, changes that have occurred over the last couple decades. The pandemic obviously brought on a great number of changes over just the past 2 years in a small, very compressed timeline. And there's no secret that labs and pathologists have had to adapt quite a bit for those changes. I'm curious, you mentioned a few different things that have impacted the RCM side, but what changes do you see persisting going forward that may have been brought on by the pandemic?
Well, I think the pandemic, in a couple of ways, forced us to look at different things. First of all, the labor force. On the pathology side, the labor force has never been tighter, and it's going to get worse before it gets better. Dr. Ed Fodia, a friend of mine and client of ours for years, wrote a great article 5 years ago predicting this would happen, and it's happening now, where we have 700 plus open pathology positions. So it's going to be harder and harder to get pathologists to fill this work. Now, will telepathology fill in some of that? Will we be able to use some AI using that going forward? Who knows? But that's going to be a big issue both for the pathology side and on the lab side, finding the right lab techs, finding the right people to do those jobs. The other big shakeup in the lab world with the pandemic is the plethora of new labs. I mean, there's 25,000 new labs in 2021. They're all going to be looking for the same piece of work, right? As COVID goes away, they're all going to be attacking the same providers. And we're going to have to find out the ones who have the great sales and great marketing and great value will be the ones that the providers will choose going forward. And they'll all be fighting for these cases. And it'll be interesting to see how that plays out. I myself predict there's going to be a 2023, maybe if we don't see another rebound of the pandemic, we'll see a huge fire sale of used lab equipment and labs that just didn't make it. And that doesn't include the labs that the OIG is going to force out of business for being grossly fraudulent.
No, you're definitely right. The coming years are going to be very interesting to see, how that plays out, and especially with OIG audits looming, which I'm sure we're going to see plenty of. And, now that we've talked about a little bit about the past, the current, past couple years here, and the present that we're in, I'm curious about some predictions you might have for the future. From artificial intelligence to value-based care, there's several innovations on the horizon that could significantly impact the way pathologists and labs do business over the next 5 years plus. In your opinion, what are the innovations your clients need to be embracing in order to thrive moving forward? And is there anything you feel that the industry is still a little slow to adopt?
Well, it's funny because I see, I live in a farming area. Lenawee County, where I live, is all corn and beans, and it's a beautiful area. But you talk to the farmers, and they're like, they remind me of pathologists and some laboratorians, that they struggle to adapt new technology. We know right now, for example, that drones can do a lot of the work that farms do. They can spot spray fields. They can look for areas of aphid infestation. They can do some really interesting things. I was talking to a couple of farmers this week, and they were saying, "Oh, those things will never take place. They'll never do anything." Yet in other places, that's the going thing. And we see this in medicine also. For example, the blockchain. The blockchain's been around for years now. It's a great way to secure data for both demographics and for results. But we've yet to see a company that I know pick up the blockchain and use it correctly, and use it aggressively. Because when that happens, that secures all demographic data going forward. You don't have to worry about ever being hacked. It's a great idea. I think that's a 3 to 5 year target thing out there. Maybe that'll happen. Another thing I look at is, you look at AI for pathology specimen identification. I know there's been a couple of them released lately, but I remember talking at the Executive War College, which is coming up in a couple weeks. I'm looking forward to going there. Talking to some companies that were looking to buy data sets so they could train their AI on GI and GU specimens. Now we're going to see that more and more become part of what we do. And maybe this will cover some of the labor shortage in pathologists, but it wouldn't surprise me in 10 years that if we see most specimens going through a scanner first and being kicked off to the pathologists going forward. That doesn't bode well for the industry of pathology. I mean, there'll be some changes there. There'll still be a need for someone who's very specific and very detailed and can make medical decision making. Remember, these are scanners; they're not decision makers. But I see these things coming more and more in the future. And one of the problems I notice in business, as I see many businesses, is change is 3 times harder than stasis. It's hard to make these changes. It's hard to dive into this. I've seen some great groups, for example, in the last 2 or 3 years, pick up telepathology that ignored it for years and said, no, this is a bad idea. And now they're saying, you know what, we have to do this. We can't afford to have someone drive 3 hours one way to do 5 frozen sections and then come back. So it's changing, but it changes slower. And I think if we look back 20 years when I started, some of these things were, if you talked about telemedicine and telepathology, people think you were crazy. If you talked about AI or blockchain, it wasn't even part of the negotiation, the talk. I mean, who knew what blockchain was? Who bought Bitcoin when it was $3 a coin? You just had no idea what it would be. It's going to be really interesting, and God willing, I'll be alive in 20 years to see what happens next. I probably won't be doing this, but it's going to be interesting to see what plays out. I think AI, blockchain, and telemedicine will be 3 of the big things that go forward.
Yeah, it's going to be really interesting to watch how those develop for sure. And thanks for the mention as well on Executive War College. Just a reminder to anybody watching, Executive War College is scheduled for April 27th, 28th with post-conference workshops on the 29th, and Mick will be presenting down in New Orleans. It's a great annual show, something we love to attend, and something we're hoping to see more faces at this year as people finally start getting back out there. So if you want to hear Mick talk about some of these items and more audit findings that we've been seeing from the recent years, definitely plan to attend his presentation. And Mick, I just want to say thank you for taking your time today. I really appreciate it, and looking forward to talking with you soon.
Thank you too, Alex. And hopefully I'll be around when your 3rd grade daughter wants someone to coach baseball. Hopefully I'll be there watching you coach her. Wouldn't that be fun?
I'm sure you'll be cheering the loudest from the stands. Thanks again, Mick.
You're welcome. Take care.